Good morning, everybody. On behalf of Institute of Biofield Evaluation and Research Center, myself, Dr. Anup Dev, my colleague, Mrs. Snehal Korgaonkar, we welcome you to this lecture, a keynote lecture on Biofield Scanning Technology, a predictive tool from your own field, that is Vedic life science.
Hello.
Hello. This center has been working to promote the Ayurveda science, the homeopathy science, and naturopathy science. We need to provide documentary evidence of the Sukshma Sharir, the invisible body. It has been 5 years we are doing research on this. Number of patients scanned 1300 plus. Number of scans we have from these patients are 40,000 plus. We are carrying out awareness lectures, number 124. We are carrying out workshops to understand this subject more thoroughly. They are number 8. We have introduced the Biofield Scan studios, the centers in and around Bombay. Number is 5. And including this, 4 international papers I have submitted so far. This is the picture of a scan, Biofield Scan studio. We are doing these activities. These are the proofs. We have a publication in Marathi and Hindi. Hindi book is available today for the discount of ₹100. It will be available after the lecture. The key word which we need to know if we want to study biofield scanning technology. It is also called energy field mapping or imaging system. Imaging system is a visual proof of what we are looking at. The ancient Vedic science tells us about the Sukshma Sharir, subtle body. It talks about the Tejovale, which is we see around all the saints, our statues, our holy leaders. Sapta Chakra, the 7 important energy zones, 72,000 meridians or energy flowing rivers. Panchakosha, I am sure people from Ayurveda must have studied the Panchakosha also. But the science behind that, we have to study the biofield science. We have to study, it will not work on the screen, quantum physics. It is the quantum physics which will take us to the spiritual science. It will give us the documentary evidence. Then, of course, the biofield scan, how it looks like and what are the important information we get from the scan. And biofield evaluation, how to extract the information. Now, surprisingly, this topic is covered in the Charak Samhita under the name of Chhaya Prabha. This is the Charak Samhita, chapter 7, Indriyasthana. It tells us about the distortion of shadow in respect of changes in the shape, measurement, color, and luster should be considered as warning signs even in the healthy individuals. It predicts the future health issues which we are probably ignoring. We see these things in the colors, and each color has some meaning. It tells us about the frequency, the Bio-photon emission. So we'll come to that point also. And I like the alternative medicines because we focus on the root cause of the disease and not the names which are available with the causing bacteria and viruses. So I prefer to get rid of the root cause and you will be symptom free. It is also documented, apart from Charak Samhita, all our holy books, the Ved, Upanishad and Rigved, also our holy books. I will try to tell you the Yoga Kundalini, Lay Kundalini, Jnana Bindu, Taittiriya Upanishad, Patanjali Yoga, Shiva Samhita, all our religious books also mentions about the subtle body, the Sukshma Sharir. It is already available in the Taittiriya Upanishad, our Panchakosh. Every individual is different. He reacts differently. It's because of the information from the Panchakosh. We call them past life karmic issue. And here we automatically believe that we have rebirths. To give you one example, this is a twin born to family in Thane. They are 5 years old, but they have become most notorious for their parents. Because one is slightly having a dark shade, the one is fair. Let's call them Ajay and Vijay. Ajay speaks more in English. He likes spicy food. He's a very troublemaker, very hyperactive, very aggressive. Whereas the Vijay is very fair. He speaks more of his mother tongue. He likes sweets. Now genetic information doesn't talk about this. But our ancient knowledge tells us that the Panchakosha Vijnan will tell us why they are two different souls. Yes, the biofield science, if you study the invisible science, we can get the relationship between the modern medicine, who have studied only the physical body, physical organs, and our Ayurveda and Vedic science, which talks about the invisible body. What is biofield science? A human body generates electromagnetic field around it, which is called human energy field or aura or a biofield. Aura is a very loose term. Aura is not a scientific word. Probably, I don't know here, but in Bombay, we have a Aura restaurant, Aura Creations, and Aura nightclub also. So, the proper word is biofield. And this is due to Bio-photon emission. This occurs in a visible spectrum of invisible spectrum of frequency beyond our sensory perception. Our 5 sensory organs fails to pick up the information from invisible body. With appropriate environment, camera, and with the help of software, this energy body or Sukshma Sharir can be visualized. And what we can visualize? Yes, the biofield means electromagnetic field around each one of us. Every species of its life has its own electromagnetic signature, a pattern of oscillation based on an individual karmic blueprint. It is different for all. And we know the reason is Panchakosha, the information in the Panchakosha. The biophoton range that we continuously emit is in the range of 380 nanometers. And our visual capacity starts from 480 nanohertz. That is why we are not able to see this biophoton emissions which is coming from our own body. The biofield is been used in a medical science. They take ECG and EEG. It is based on the electrodes placed on the chest, and we get the information about the heart. Patients who are having lot of brain issues, we take EEG. We never open the brain and see how it is functioning, because it is producing some biofield, because there is a biochemical reaction which which prompts the different biophoton emission, and it is picked up by these electrodes, and through the graphic interference we get the information about that organ. And what is the biophoton theory talks about? Professor Alexander Gurevich discovered the existence of biophotons in 1941 during the mitogenic radiation work. Biophotons are always emitted before every biochemical reaction. The emission of biophotons is expression of functional state of living organisms. We call them 5 desires, Shadripu. They will, when we undergo these changes, emotional changes, there will be a modification in the biophoton emission. The measurement can be used to assess the functional state during any physical, emotional and mental issue. A causative disturbance is always found in quality and quantity of biophoton emission. What is Biofield Scan? Biofield Scan means visualization of electromagnetic field around the body, energy zones, that is chakras, meridians and panchakosha of the invisible body or sukshma sharir. Yes, we can now see these koshas, see these chakras and the meridians of the sukshma sharir, and we can predict about the physical body also, because our ancient knowledge tells us it is the sukshma sharir, it is the invisible body that runs the physical body, that is your annamaya kosh. So the biggest advantage of this photography is during any physical, emotional and mental issues, a causative disturbance is always found in the quality and quantity of biophoton emissions. Cancer cells and healthy cells of the same type can be discriminated by typical difference in biophoton emission. So there will be a different range of biophotons, and that's how we will get the different colors. How it is connected to Ayurveda Chikitsa? Yes. Most of the therapies like Ayurveda consider symptoms as a means of body to attract attention to the problem and not the problem itself. But often symptoms which are merely expression of underlying cause or energy imbalance are confused with the disease. So we need to, thus it is important to focus on identifying the root cause rather than the treatment regime based on symptoms. And that is why I prefer Ayurveda, homeopathy, the alternative medicine, but which we are working to get them in a mainstream now. So this is the Biofield Scan studio. It is a dark room having a white walls, no furnitures, and then there is a certain protocol of the tube light and camera and software. But here we can scan everyone. We can scan even the non-living things, Rudraksha, plant, every char achar, all emits biophotons, and that is why we can scan them. Here is one example of the software. You must have seen few people who have lost their hands and legs. If this person is told to hold the existing broken arm, and if you hit a stick on a non-existing broken hand, he will get the pain. The medical science says it is the phantom pain, because you are feeling it, but there is no hand of yours. But if you take a scan from that side, you will see the energy body, energy hand, which is giving him the feelings. And this is what the first Kirlian photography established, that we have invisible body and we have visible body. Visible body can be destroyed, Annamaya Kosh can be destroyed, and not the energy body, the Sukshma Sharir. Yes, the diagnostic points revealed in the Biofield scans are able to clearly show the outer energy layers, your thought process. Patanjali Yoga Shastra says you have two bodies. One is the thought body and the other is the physical body. It is the thought body which affects the physical body. We are able to see your thought body. 7 chakras and their current energy status, balance or imbalance. 14 meridians, main meridians, and if there are energy blockages, which helps the acupuncture people. And therapeutic energy at work. You give any treatment, first change will take always in the energy body. Then it slowly travels to the physical body, which we will be able to pick up. Again, now if you have the Biofield Scan and if you want to interpret it, again we have to go to the Charak Samhita, the Chhaya Prabha chapter. It says, all variety of lusters are constituted of Teja Bhuta. They are classified as 7 types, namely red, yellow, white, brown, green, pale, yellow, and black. Of them, which are smooth, bright, and dense, are auspicious, and those which are dry, dirty, thin, are inauspicious. So in terms of colors, we can pick up this information, which is a great breakthrough. So scope of Biofield Scan, how it is more useful, we will see it in 2 minutes. The existing medical science has studied the physical body extremely well. And that is why we have all the tests which are related to each cell of our body, each cell of our organ. But this is true only when the disease is on the physical level or physical body. What about the psychosomatic diseases which you just heard about it? What is about the diseases of the mind, mental and emotional issues? They are not picked up by this medical test. But what is the advantage of this Biofield Scan? Painless, no invasive, cost effective, and no contraindications. Even a pregnant lady, even a 2 days boy, a very terminally ill patient can be scanned. You all know that patients with pacemakers, patients with artificial cardiac walls cannot be subjected to MRI. So ours is the universal. Describes not only present pathology but also past event and future issues in physical, psychological, emotional and spiritual dimensions. No possibility of side effects because you are photographed from 8 feet. No touch, no invasion, no pain. And one more thing, you are not given any radioactive medicine which we need for a contrast MRI and PET scan. Inside out scanning methodology, we will pick up the energy within the body. In the medical science, MRI, your X-rays, energy is thrown onto your body and the information is picked up. So that information can get modified. It's predictive. Early detects possible future health issues. We will see in some scans. Points to the root cause of health issue, enabling effective remedies. Whether it is in Panchakosha, whether it is in chakra imbalance, whether it is a blockages meridian, we can pick up and work out the treatment according to it. Useful diagnostic tool for the mental and emotional issues seen more in the ladies. All over the world, including in our centers, we have more ladies scan than the gents scan. That is because the mental and emotional issues, most of the time, the husband takes the wife to the doctor, the best doctor, he advises some few more list of tests, and they all come normal. And then it is assumed that there is nothing wrong with the lady. So this is the ancient system which works very good for the ladies. No special and expensive infrastructure required. Do you know the cost of setting up this scan center is? Not in 50 lakhs, not in 1 crores. Only 3.5 lakhs. So what is the scope of Biofield science? I will just pick up the most important point, it has ability to detect and highlight the areas of potential debility and warn the key person of any organization with immediate danger to the health issues. You all must be knowing that in most of the corporate houses, all the employees undergo an annual medical checkup. They all come normal, but within 4 or 5 months, somebody gets a heart attack. Because we have not picked up the complete information of this body. So biofield evaluation, it's a full body scanning system for physical, mental and emotional issues. It's going to be future health scanning system. Let's take some few cases. Neurological issues like MRI. We pick up the information like MRI. We pick up the information from the Anahat Chakra and tell that person that you are under stress. You must check your BP, you must check your exercise, you must check your lifestyle. Thyroid issue detection, very common. Liver issue detections from the solar plexus. Varicose veins, renal issues, we can predict the renal inefficiency or the kidney dysfunction by asking them to do the creatinine, and it usually has started elevating from 4, 5, 6. Prostate hernia piles issues can be picked up from sacral chakra. Vitamin D deficiency we pick up from the root chakra. Low immunity cancer, psychic attack detection, infertility issues, headaches, insomnia. We see the root cause in the Sukshma Sharir. IBS. This is the biggest challenge to my best friend who is a gastroenterologist, Dr. Aruna Bhave. She has started now giving mood elevating medicine instead of the digestive issues, for the digestive. This is the CEO of the company, has undergone all the medical tests, but he was not happy with the why he would feel breathlessness. And we have detected the issue right in the Anahat Chakra. This is a boy having a drooping eyelid. We can pick up those points, GB1 and TW20 on the meridians, and this eye drooping can be corrected without any surgery. This is a case of depression. The same, you can see the half circle in the red color around the brain, and this person already had an MRI 3 years back because of his issue, mental issue. It shows the same red line, same red curvature. So it is like our MRI. This is the predictive medical alerts. We can tell this person that you are pre-diabetic. This is all happening in one scan. And when he undergoes the HbA1c, he is already showing the figure. Sometimes we pick up some information and ask the person that, are you having tobacco in your mouth? And if you open that mouth, you will see the evidence. This person, we predicted there going to be a big issue in the brain 10 months after he had the bleeding at the same point, which was confirmed by MRI. That time he was having the right side paralysis. Infertility, most of the cases we find that it is the stressful life conditions. Their medical reports, both husband and wife, their medical reports are normal. But it is the stress factor, and as the one speaker, the lady speaker who spoke, it is the Daivik issue, some past karmic issues. The behavioral issue with the child can be read, and accordingly the treatment can be instituted. The traumatic childhood and the behavioral issue also can be modified. Patients undergoing full body checkup but having psychosomatic issues are properly read. Persons having a fall and has been told that you have to be careful about the right hip, and after 4 months he was admitted in the hospital for the same. Thyroid and PET scan, you can see the location of the activation at the same place. Some of the testimony, sometimes we pick up some information and we want to make the person understand how serious it is. We say we advise some medical test, they all come positive.
Sir, please conclude.
Yeah. This is the acupuncture before and after. This is the music therapy or Gandharva Chikitsa. You can see the change in the water before and after. This is the knee pain. You can see the change before and after. So conclusion is, chakra and energy body can be seen with Biofield Scan with the help of Vedic view of human body. The interpretation of Biofield Scan becomes reliable. Correlation between chakra and panchakosha, this information is available to us. Scan describes not only present pathology but helps to predict future issues in physical and psychological, emotional dimensions. Scan detects mental and emotional issues, spiritual progress where modern medical science fails to do so. Biofield Scan points to the root cause of health issue, enabling effective remedies. Thank you. Any questions?
Dr. Anjali Duhan, प्लीज आ जाइए स्टेज पर.
Prabhatam.